explain what Medicaid reform means?
Think of the word reform as meaning to strengthen and improve. We want to strengthen the system. We want to improve the quality of care that's delivered. From a system standpoint, what we're looking at are the health outcomes of the community overall. We're looking at the health outcomes of the individual, and we're trying to make the system more predictable from a cost standpoint. From a delivery of care standpoint, we're focusing on people as whole people, meaning we want to connect the head to the body, physical health and behavioral health. And the second element of improving the delivery of care is to give even more attention and more support to the providers who are giving that care to our beneficiaries, our consumers, every single day.
How do you see Medicaid reform affecting individuals with disabilities?
Really, in the near term, it will not be affecting people with disabilities. And the reason why is today in the state of North Carolina, we have a system that uses LME MCOs to oversee the care to those communities. By session law, the role of LME MCOs will be unchanged not only prior to Medicaid reform, but also for years after Medicaid reform. So there's a commitment to keep LME MCOs in place. From a timing standpoint, Medicaid reform will not occur or go live at least for 3 more years. So we know that over the next 3 years, my focus, my interest is in terms of expanding slots, meaning services for people with disabilities, but in terms of affecting Medicare reform's effect on people with disabilities, it will not have an effect. The services that are offered will remain the same.
You recently had a series of Medicaid Reform public hearings around the state. What did you learn from them?
One of the first things I learned is that people who attended really care. They're really involved. They came highly prepared. At the beginning of each session, we would ask, how many people have actually read the waiver, the application for Medicaid reform? And roughly 80% of the hands in the audience were raised. If you think that roughly 150 to 200 people came to each session, and that we had roughly 1,500 people across those 12 public hearings attend, that's an amazing level of participation by the public in terms of giving us feedback on Medicaid reform. Now, some of the themes that came up were the following. One is, of the people who came, there was strong advocacy for Medicaid expansion. In terms of groups of people who came, if there were ones that had concerns about Medicaid expansion, it really was families with a family member who has a disability. And the reason why is that they're concerned that Medicaid expansion, the funding that would go to expansion, would, if you will, jump ahead in line in front of folks that are still on waiting lists for services. With regards to providers, we had very strong representation by providers. And their primary concern was, are there going to be increased administrative burdens as a result of Medicaid reform? And so we're listening to them and building in their suggestions into our design of Medicaid reform. So ultimately, quality and access is something that everyone was concerned about, meaning maintaining or strengthening it, and we're committed to doing that.
What are the next steps for Medicaid reform, and what timeline does DHHS anticipate in these next steps?
The next step comes real soon, on May 1st, where we're going to be publishing a report to the legislature on what our transformation center that would support Medicaid reform would do and how it would operate. What a transformation center is going to be all about is to spread best practices to essentially accelerate the process of transformation toward these goals of improved community outcomes and improved individual outcomes. After that, the next milestone will be June 1st. On June 1st, we'll be submitting our revised, meaning our finalized version of our Medicaid reform application, which is called a waiver, to CMS. Then over the next 18 months, we'll be discussing that waiver with CMS. After we receive approval for that waiver application, that waiver reform, we'll then be preparing for implementation. So think of our timeline is 3 years from June 1, we expect to go live with Medicaid reform.
The call for public comments for the 1115 waiver ended on April 18th. What additional advocacy opportunities will there be?
There continue to be advocacy opportunities because we continue to be committed to engaging and listening. The easiest way of letting us know what you're thinking about is to go to the Medicaid Reform tab on the North Carolina DHHS website and submit your ideas there. So that continues to be open. If you prefer to call us, you can call. If you prefer to drop off, your comments in writing or mail them to us, all of those opportunities continue to exist. But don't forget to continue to leverage your advocacy associations, such as the North Carolina Council on Developmental Disabilities.
Do you have any other tips or advice on how people with disabilities and their family members can make a difference in the system?
The most important thing I could share with you is be seen and be heard. People need to meet you. They need to see you. They need to listen to you. They need to be in your presence. Have them take their time to really understand who you are and what's important to you. They'll listen, but you have to be seen for people to listen to you. And my personal experience to date has been that when people are in front of you and when they're with you, they'll be drawn to you. Regardless of what your story is, share your story in as convincing of a way and as open of a way with the same degree of emotions with them as you have had with me. Because I consider myself blessed as a result of having heard these stories.